And we are really excited to announce something that has been a long time coming, which is that we have a situation in the United States where we have the most aggressive vaccine agenda and policy on the planet. And we also have the sickest children. And so we are co founders of Stand for Health Freedom, a nonprofit that in 2019 basically gave the grassroots movement here in the United States a way to really have a direct means of impacting their elected officials on informed consent, parental rights issues. And we're here to tell you today that we are proud to be part of the new CDC lawsuit. So I'll just let Joel give you a little update on that.
Yeah, so as of Friday, the 15th, Stand for Health Freedom is suing the Center for Disease Control, along with Dr. Paul Thomas and Dr. Ken Stoller. And the reason why we're suing the CDC is because in 1986, when the pharmaceutical companies were given immunity from liability, as part of that act, the National Childhood Vaccine Safety Act of 1986, in that act it says um, that the CDC and HHS specifically was supposed to provide the public and specifically Congress with safety data on the entirety of the childhood vaccine schedule and the safety of children. And they were supposed to do this, what it said is periodically, like quite regularly. And they had never done it. And then again in 2003, the Institute of Medicine, which is known as the National Academy of Medicine today, asked the CDC to provide the data and to do the research again, and they never did it. The Institute of Medicine, again in 2013, asked the Center for Disease Control to provide data on the safety of the entirety of the childhood vaccine schedule, and they didn't do it again. Now, to put this in perspective, the CDC's vaccine schedule for children is the most aggressive vaccine schedule on the planet. So nobody recommends more vaccines than in America from the CDC. And now what's happened is over time, there's now mandates, and the mandates are you need to get vaccinated to go to school, right? And so what we've done is we are suing the CDC for not performing their duties of providing safety data to the public while providing mandates. And there is law that actually the law, what the law does is it says that you're not fulfilling your responsibility, and so you can't actually provide mandates if you're not fulfilling the basic.
Yeah.
Right. And so it's such an interesting, it's such an interesting angle on how to sue the CDC. And I believe that this is the most intelligent, number one, and number two, the largest lawsuit potential that the CDC has ever faced related to vaccines in general in the US.
Yeah, it should be noted too that the Advisory Committee on Immunization Practices, it is an advisory committee. So their recommendations are not law. Essentially, however, all the states of the United States are taking their recommendations as a law, and they are then coercing parents in order to basically require they comply with this schedule in order to have access to education, for example. And in many cases, even pediatricians are so called firing their patients when they have legitimate health concerns because they won't comply with a schedule that is not evidence based. Because, as Joelle's pointing out, you have to do clinical studies, you have to do safety studies, which are not being performed on the present schedule. There are individual vaccine studies that don't use saline placebos, by the way, but no synergistic toxicity studies, which are the ones that they are mandated to do in order for, again, these so-called mandates to be in effect.
Yeah, so just a little bit more background on why Stand for Health Freedom, why Dr. Paul Thomas, why Dr. Ken Stoller. Dr. Paul Thomas is a pediatrician. And because the CDC has never provided this data, what he did is he actually he has decades of experience 25,000 patients approximately, and he gave the data to data scientists to analyze to see, is there a difference? Can they see a difference in his patient population of the patients and the children who were completely vaccinated, partially vaccinated, and unvaccinated? And they found an insane difference in the vaccinated versus the actually partially vaccinated. And again, a huge difference between the completely unvaccinated in terms of overall health.
Well, one example is allergic rhinitis was 30 times higher in the vaccine compliant. Can you imagine that? 30 times increased risk of this condition, not to mention asthma, and then, of course, autism.
Yeah, and as we all know, Secretary Kennedy came out a couple of weeks ago, and he shared that the CDC did do research in 1998, but they buried the research. They didn't bury it. Actually, what they did is they did 5 iterations of statistical manipulation of the data to show that vaccines did not cause autism. And specifically, they looked at the only one, the hepatitis B vaccine, which is given within the first day, between the first hour of birth and the first 30 days. And so they, in 1998, did research and compared that to children who had delayed the vaccine and children who didn't vaccinate. And ultimately, what they found, and Secretary Kennedy came out and said this a couple of weeks ago, that there was an 1,135% increase in autism in the children who received the hepatitis B vaccine in the first 30 days of life compared to children who delayed it or children who never got it. Okay. But the way they hid it is they got statisticians to go through 5 iterations of manipulating the data. And ultimately, what they did in step 5 is they removed all the 2, 3, and 4-year-olds from the research because especially back in 1998 and still today, it's very difficult to give the diagnosis of autism to a 1-month-old or a 3-month-old or a 12-month-old because they're not fully developed to be able to see their social cues and all their eye contact and the sound issues and things like that. And so by removing that population, there were no more autistic children that they were tracking. Does that make sense? And so they basically just said, oh no, it's safe and effective. Vaccines do not cause autism because they manipulated the data. And what we're asking for the CDC to do is not just the one on the hepatitis B, it's the entirety of the approximately 72 vaccines that a child gets in their lifetimes.
And here's a quick point. If you look at the introduction of the Gardasil vaccine, that was the first vaccine that was approved through surrogate markers of efficacy. So there was not a single clinical trial, no evidence that ever prevented a single case of cervical cancer. What they did is they looked at things like antibody titers, right? And that's the new model.
Correct.
So, but keep this in mind. Gardasil is a genetically modified antigen product from yeast, and yeast is actually known as a mini mammal because it has a 33% homology with the proteome or the gene byproduct proteins in the human genome. So if you're injecting that yeast product, with, yes, there's some HPV antigen mixed in, theoretically you have hundreds if not thousands of proteins that are basically identical to human protein. So no wonder preceding the rollout of the mRNA technology with COVID vaccines that the Gardasil vaccine was known to be the highest adverse effects of any vaccine ever deployed. So what I'm saying essentially, one vaccine, your Gardasil vaccine, could be considered like having hundreds of vaccines because it has hundreds of antigens. Then you add in the adjuvants that in order to kick the beehive of the Th2 or the so-called humoral side of the immune system that produces antibodies, and all these self antigens are produced where the body is attacking itself. So this is the perfect formula for illness, and it's very hard to even discern the chronic effects of those vaccines. And essentially, if you just look at VAERS alone, which are more acute events, we know that the children of this country are being absolutely devastated by this schedule. So what's happening now, thankfully, is this is the first lawsuit. It's written so succinctly. We're going to put down the links underneath this broadcast so you can read it yourself. It's only 27 pages. That is going to hold the ACIP and CDC, HHS to account for what they are legally obligated to do to protect the safety of our children. And that's the beauty of the situation is the whole house of cards collapses if they just simply follow the law. They don't even need to apply common sense because clearly they've never done that. Like look at hepatitis B, right? That's for
That's right.
vulnerable populations who are multiple sexual partners unprotected or intravenous drug users. You don't inject a baby with aluminum and synthetic antigens to try to make them better when they're not even at risk for those diseases. And that's if you subscribe to the conventional model of, contagion, which I don't personally subscribe to that. So otherwise, this is a historic event, and we are so happy to announce this.
Yeah, and it's interesting because Dr. Paul Thomas obviously lost his license when he released the data on when the data was released on his research. And to go back to Dr. Kenneth Stoller, what happened to him is he was actually doing potential genetic testing to see, do vaccines like actually affect people who have certain genetic subtypes that might make them more at risk of developing issues than others. And when he released the data of his studies, he lost his license as well.
Hmm.
Right. And so as for Stand for Health Freedom, the reason we are a plaintiff in this is because we have had to divert funds to alert people to attempt to protect their informed choice, their informed consent, their parental rights, because we don't have them as much as we think we do. I moved here from Canada 15 years ago, and what I found is that, here it's actually much more restrictive. You can't just go to school. You have to get a religious exemption or a medical exemption if you don't want to follow the CDC guidelines. That's not a free society. That's not a free country as I thought a free country America would be, right? And so ultimately, the goal of this lawsuit is to undermine the mandates and whatever mandates those are. But everybody understands the childhood, the no shots, no school mandates. There are other mandates. I mean, my son just started as a freshman in college, and he needed a religious exemption to go to college to continue his education. I mean, that's absolutely ridiculous. Why would we need a medical procedure and inject ourselves to be able to learn? Right? That's completely insane. And so I believe that with this angle, using administrative law to show that what the CDC has done is arbitrary and capricious. And in being arbitrary and capricious, it has not upheld its fiduciary duty. Therefore, the mandates should be terminated. And that is the ultimate goal of this lawsuit. And we're so excited that Stand for Health Freedom is bringing this
Yeah.
to the CDC.
When you read it, you'll see that there are four main claims, and those are very backed up by what has been happening to basically millions of parents and their children, which is a violation, first of all, of Administrative Procedure Act. Okay, so the CDC did not follow the law when it came to these essential safety studies that have to be performed.
Well, and by the way, just I didn't mention this, but in 1986, the act actually says it has to present the safety data to Congress,
Mhm.
and not once have they ever
No,
presented safety data to Congress about the entirety of the vaccine schedule.
absolutely not. And that's why we're looking also to get more support to call for congressional hearings. And as Stand for Health Freedom is a grassroots organization with 41 state leaders, as well as over 1 million advocates on the list. So, one thing you can do is make sure that everyone that you know knows about Stand for Health Freedom because it exists solely to support you and your health rights and to protect your children. And this is such a great example. The other things in the lawsuit that you'll clearly see represented are First Amendment rights, okay? For Fifth Amendment rights, as well as basically all the suppression of dissent that we all went through over the past 5 years. This is exactly what's happening to the practitioners in this country that are doing exactly what they're supposed to, right? Ken and Paul, they were using evidence based medicine and they were individualizing their treatment recommendations. By doing that, they were stripped of their licenses and they were basically deprived of a livelihood and their reputations completely destroyed. This is an opportunity to get restorative justice for them and anyone brave enough to practice medicine the way it was supposed to be practiced. Do no harm, follow evidence-based practices, and really focus on the welfare of the children first and foremost, not the bottom line of the pharmaceutical industry, and not trying to cover up up the immense harm they've done under the watch of our regulatory agencies.
Yeah.
So keep in mind that, at this point, Stand for Health Freedom is really an organization that has no primary funders. There's no one out there giving it, donations. It's all because of you. And actually, quite frankly, you and I have put a ton of our resources, energy into keeping it alive. So we really need people to make sure that if you care about this issue, please do something to support this lawsuit. I think they even have a matching up to 50,000.
Yeah.
There will be a matching donation. And that's not a lot to ask. But essentially, the more we can get the word out on this, the more likely it is this lawsuit will succeed. So we really hope that you guys help us with that.
Yeah, thank you for that. And also, it's important to note that a lot of people are like, well, Secretary Kennedy's he's head of HHS, right? So he's going to take care of everything. And that's not necessarily how it works. He can do some things, he can't do all of the things, right? And so it's still important to activate the grassroots. And I feel a sense of urgency personally because we don't know at the midterm elections, we don't know if they don't go our way, for example, right? That maybe the administration says, okay, Secretary Kennedy, you need to stop doing all these things.
Yeah.
And they forbid him from actually activating his entire agenda.
Mhm.
And so it's important for us to act quickly and decisively in a very professional way. I mean, the experts that we've consulted who have looked at this lawsuit have said this is probably the best lawsuit they've ever seen in the history of the US against the CDC to be able to at least give back personal choice and co-choice between doctor and patients to the U.S. population.
Mhm.
So it's a very exciting time. There are a lot of things happening. Obviously, Secretary Kennedy just fired the whole ACIP board and then has replaced them, which is a positive sign. But this even I think will supersede that in terms of its impact on millions of children and adults, not just the teens, but the adults as well,
Yeah.
because there are no mandates and there can't be any mandates if we win this lawsuit.
Yeah, this if successful, this lawsuit would essentially make possible the ending of blanket vaccine mandates across states. So that is a massive opportunity. It will restore individual medical decision making,
Yes.
and it will expose decades of neglected, evidence of vaccine harms. So this is a massive opportunity. What you can do is you can learn more about the topic. Actually, our executive director and co-founder Leah Wilson and her husband have an incredible podcast where they break this down in depth. That's the One Dream podcast. We'll have links to it when the replay.
Yeah, they brought on the lawyer Rick Jaff.
They did, yeah.
Right, and Rick Jaff has also been co-litigator maybe a half a dozen times with Bobby Kennedy as well on
Mhm.
different cases in the past.
Absolutely.
Yeah.
Yeah, I mean, so there have been so many wins, but as Joel says, it has to be a grassroots effort. As we see, there's a lot of politics involved. The midterm elections are going to be one heck of a battle. But what we can do is not really get involved in that. We can continue to advocate for our rights, for protecting children's health. And it really just takes you really, getting involved. Like
Yeah.
take those steps, share this with others, and but basically buckle up because we have the most historical opportunity I could have ever imagined to truly end this assault on the health of our children with big pharma having complete license to stripped of any liability. They're not even obligated to follow basic scientific protocol to prove safety and efficacy until now. This is when the rubber hits the road.
Yeah, and if you want to learn more, you could watch the One Dream podcast. You can go to standforhealthfreedom.com. You can also, if you want to donate, that would be absolutely fantastic because, as you know, these things actually cost money. And we're if you have any questions, go ahead and ask. Can they ask questions?
Yeah, sure.
Yeah.
Absolutely.
So if you have any questions, go ahead and ask questions. We're going to put the link down to the lawsuit.
Yeah,
Is that right?
we have a report on Stand for Health Freedom about the
Yeah.
new lawsuit with a link to the actual lawsuit, which you can disseminate as widely as possible.
Yeah, and I just want to say, like, the ground is fertile right now for this. People are waking up. There's been so much oppression, so much censorship, so much disinformation, so many lies over the years that we have a very small window of opportunity to act, and that's why Stand for Health Freedom is proud to take advantage of this moment and to aggressively go after the CDC and support the other pediatricians in this lawsuit to make significant change for the millions of Americans that this can impact and for future generations as well.
Absolutely. The origin story of SHF was really about our concern for our children and the rights of those we loved. And essentially, it's all coming to pass that now we have really a grassroots movement that is not affiliated with a particular party. No matter how hard the media and other forces want to try to break things into Republican, Democrat, this is a issue, right, that is globally relevant. I mean, I can tell you this because I just got back from having to travel overseas due to essentially being targeted through transnational lawfare. And I can tell you that there's now a global movement in Europe as well to look at what we're doing in this country and apply the health freedom wins and the sovereignty advocacy on a global level. And that to me is so exciting because we have larger standing armies with pharma and the medical complex than we have actual military now. And what we're seeing is the world has woken up to that over the past 4 years, but we still are seeing the most egregious, draconian, and quite frankly, deadly policies being forced upon us and our children. We can leave the WHO, but then there are all these WHO collaboration centers in the United States. They're literally putting the tethers of their control into our schools through these, health-based centers that SHF is taking the lead on as well to protect your children in public schools.
Yeah, they're called school-based health centers.
That's right,
Yep.
exactly. And that's an example of where we all have to continue to do our best to assert our rights. And this is one way that you can do it.
Yeah, thank you.
Yeah.
Anything else we want to share? Any questions?
If there's any questions, feel free to put them in the thread. Otherwise, another good announcement is that Stand for Health Freedom is going to be on Substack now. And I'm very happy to say that from what I can see, it is really one of the best platforms for those who do want to speak without being worried about being censored. So that's another thing that is, I think, going to help to grow our movement. And thank you for putting the link in there. So I think for now, what we'll do is we will send this replay out with all the relevant links. And, I just want to say everyone that stood with us throughout these years, who put in the time to take, part in some of the actions. I don't know if you know this, but Stand for Health Freedom has just 2 full-time employees, and they had over 240 different campaigns that they were involved in supporting the grassroots throughout almost every state in this country. I can't even tell you the dedication involved. No one even
Well,
has.
I can tell you the updated numbers. There are 9 federal calls to action currently, 199 state and local level calls to action. And we've had 60 legislative wins with the help of Stand for Health Freedom. So we're so proud. We're so thankful for your help. We're so thankful for your support. We're so thankful for you to just join the list and send the emails to your local politicians to make real change, because that's really what the beauty is about America, is that there still is the option and the potential that the grassroots can make a change, but we have to act. And so we appreciate you for being here and acting with us.
Absolutely. We can keep going on and celebrating this win with you, but it's time to act. So thank you again for being part of this. Please take part in sharing this campaign and making other people aware. I think hopefully, if this goes away, I think it will, we will all be celebrating a historic health freedom win. But it will depend on you taking part.
All right, let's do this together. Thanks, everybody.
All right. Thanks, guys.